You ever wonder why do plastic surgeries get canceled on the surgery date? Well, here are 10 reasons why your plastic surgery may get canceled on the day of your surgery. Here are 10 reasons why your plastic surgery may get canceled on your surgery day. Number 1. Failure to meet BMI requirements. So every surgeon has his or her own BMI requirements. BMI is your body mass index. It's calculated using your height and weight, and there are many free BMI calculators that you can easily pull up on Google. Because your BMI doesn't take into account your lean muscle mass as opposed to just fat, it's not a full reflection of a body's composition, and some surgeons understand this. So they may be lenient on their BMI requirements. Other surgeons, not so much. Some surgeons are not even quoting you if you don't fall within their BMI limits. As your BMI goes up, your potential for complications increases, such as DVT, pulmonary embolism, and chance of a heart attack during your surgery. Cardiac problems, cholesterol issues, liver problems are all associated with higher BMIs. If your plastic surgery is not being performed in a hospital, you will find that your surgeon probably has a BMI max limit that's on a little bit of a lower end, as surgeons who operate in the hospital tend to take higher BMIs. BMIs of 25 to 30 are considered overweight, and many surgeons will not operate on a person with a BMI over 34. And lots of surgeons choose not to operate on people who are over a BMI of 30, especially if combining procedures. And even then, the more common BMI max is actually like a 28. Additionally, BMI requirements are set in place so that you can achieve the most optimal results from your plastic surgery. Number 2, underlying or undisclosed health issues. Now, what I mean by this, these are things that will probably come up once the surgeon reviews your pre-op paperwork or during your pre-op evaluation. Sometimes it's the first time actually meeting your doctor. And sadly, sometimes it's your surgeon's first time even seeing you, and maybe they've never even seen your pictures, which I'll get into a little later in this video, because that can cause all sorts of other issues. Maybe from the surgeon reviewing your paperwork or evaluating your body or having a cursing conversation with you, something comes up and there's additional testing needing. So the surgery may be postponed, and it may be something as simple as just having some additional testing, such as say an EKG. And with that said, get yourself an EKG. It's not just for old people, okay? Whether you need it or not, whether it's a requirement or not for your surgery, get an EKG. And whether you're going overseas and they're going to test you once you get there and they say you don't need clearance at home, do it anyway, okay? Be ahead of the game, know what's going on with your body, get clearance on your own regardless. Hemoglobin testing is another important one, and that usually comes with your clearance. Sometimes it's different overseas. It's different depending on the doctor that you're going to. So just make sure you know your levels, your hemoglobin levels. Make sure you know your blood type. What happens if you need a blood transfusion? Make sure you know what you need. Make sure you're able to advocate for yourself, okay? And you know where you stand. And I don't want to get off track too much. That could be a whole separate video, but that's number 2, underlying or undisclosed health issues. So just don't sit there and think that something's not important when you're filling out that initial paperwork, even just to get your quote. Let them know about your medical history. It's very, very important. Number 3, you get sick. What do I mean by you get sick? You have a cold or fever. A fever is a clear indication that your body's fighting off an infection, so your surgery would be canceled. If you've had a cold or sinus infection within 2 weeks of the surgery, your surgery is likely to be canceled. If you've had an asthma attack or excessive wheezing the last 2 weeks before your surgery, your plastic surgery would be canceled. If you had pneumonia or bronchitis within a month, your surgery would be canceled. This isn't across the board, but that's what you'll see with most board certified plastic surgeons. And you don't always know these things, and sometimes you may have filled out your pre-op paperwork or that initial paperwork months before any of this, and then you forget to tell them that you've been wheezing or that's something that you had an asthma attack. I don't know, it happens. Sometimes people forget to mention important things to their surgeons. Number 4, poor planning, not following instructions. For instance, while you're pre-op, you're taking your multivitamin, getting ready for your plastic surgery, and that multivitamin has vitamin E inside. You failed to read the list of herbs and supplements that you are not supposed to have before plastic surgery because you thought, I'm just taking a multivitamin. This is great. This is going to help my healing. Well, vitamin E is a blood thinner, which can complicate your surgery, impact your wound healing abilities, and increase risks during recovery. So you really should not have vitamin E before plastic surgery. And this is something that could come up, and your plastic surgery is canceled on the day of your plastic surgery. Usually your pre-op visit is before your surgery. Oftentimes the day before your actual surgery day, and your surgeon will tell you, depending on what time your surgery is the next day, they'll say, after this time, no more eating or drinking. Say that you forgot to stop eating or drinking, and you went there the next day, your surgery could be canceled. Poor planning, not following instructions. Now your surgery's canceled because you just had to go and get coffee in the morning and forgot, or, you got a little hungry in the middle of the night. I don't know. It happens. And this can cause complications during surgery or recovery, and that's why the surgeons tell you don't eat or drink. Post-op. Poor planning with post-op. Say that you don't have a ride for after surgery, or you have no one to take care of you after surgery. Now, some surgeons and some practices, some clinics are more strict about this than others, but you absolutely need someone to drive you after surgery. You absolutely need someone there with you, overseeing you, taking care of you after surgery. So if you fail to plan for your post-op care, some surgeons will cancel your surgery. If you have no one to care for you, you can hire me to come with you, girl. My bags are always packed at the door, okay? No, but seriously, I offer travel companion services, and you can find that service on my website, bodyum.net. We're not trying to get our surgeries canceled on the day of surgery. We're not trying to get our surgeries canceled at all, but especially not on the day of surgeries, okay? Period. Number 5, change in surgical plan. So the in-person consult reveals that a new approach is needed. Example, you see a surgeon and your surgeon tells you that you absolutely need a tummy tuck. And you say, I don't really want a tummy tuck, I don't want the cut. And they're like, listen, you need muscle repair, you have diastasis recti, your stomach is bulging out, you have internal fat, but we're not even going to discuss that because your BMI is within my requirements. But you absolutely need a tummy tuck. I need to tighten those muscles. That's the only way I'm going to get your stomach halfway flat, and that's the only thing I'm willing to do. Well, one, you have to decide, do you want the tummy tuck? Do you have the funds for the tummy tuck? I don't know. You may have to cancel that day. You may have a lot to think about. You may have to come up with the money. You may have to discuss this with someone. Who knows? Depending on your situation. You may decide, well, maybe I should just make it a mommy makeover and get boobs too if I'm going to do a tummy tuck, and I should save the lipo for another time. It all depends, but there could be a change in the surgical plan, and for that reason, your surgery could be canceled on your surgery day. And a more extreme case of this would be that the surgeon suspects that there's some sort of mental health disorder, like BDD, body dysmorphic disorder, and then maybe they may even just refer you to a therapist instead and cancel your surgery. Number 6, you have unrealistic expectations. So remember I said that you may be meeting your surgeon for the very first time? Imagine they're telling you something that you are hearing for the very first time. So for example, you go for a BBL, a Brazilian butt lift, and they tell you, hey, you have very tight skin. And you're like, okay, what does that mean, Zach? Because I want a fatty. Am I gonna be telling me where to get a fatty? You gonna make this a horse or not? And they're like, I'm not really sure because you have really tight skin. You're like, what do you mean? Now you're telling me that I'm not gonna be able to get the cake that I want? Because this whole time they've been saying, hey, congratulations, babe. You are the perfect candidate. You're the perfect candidate for this surgery. They never said that your skin was tight, and then you lose it. Just imagine that you lose it. They're just like, you know what? I'm not gonna do your surgery. I mean, I've been denied before. You probably know the story. Maybe you don't. You may hear about it later. Make sure you subscribe to my channel, because I still have so much to share with you guys. But that brings me into number 7. Maybe you're dealing with a shady ass clinic. specifically probably a shady ass Miami clinic, they are known to cancel surgeries on the day of surgeries. Sometimes they're nice enough to cancel you a week before, you know. They are known to cancel your plastic surgery on the day of your intended plastic surgery. The doctor can see you and not that they can deliver, and I have the balls to tell you that and come up with a reason to cancel your surgery. Maybe the doctor just doesn't want their name on your body. The doctor could be overbooked and literally not able to fit you in. Sometimes it could be something really shady. There could have been a death that day that they're trying to cover up and they're canceling surgeries. Sadly, it could be that the doctor's no longer at the clinic and they haven't even revealed that to the patients yet, and you're just sitting there waiting for your doctor to get you, and you don't even know that soon someone's coming out to tell you, oh, you know, you have to choose between Dr. A or B for your surgery, but your doctor isn't even an option. And then you'll say, well, what do you mean? I signed a contract and, you know, with this doctor. And they'll say, oh, no, your contract is actually with the clinic, hon, so which doctor? Or maybe they don't even give you a choice. They'll just throw you on to another doctor. And you may say, no, forget this. I'm not doing this. Or they may just tell you, this doctor can't do your surgery without an explanation. And trust me, that happens too. So even if your pre-op appointment isn't on your actual surgery day, which is nice, it is very likely that you're going to be tested on your surgery day. Even if you're going to Miami and you were cleared back home, you'll still be tested for at least 3 things: pregnancy, drugs, and nicotine. And number 8 is positive test results. And there's something positive about these test results, okay? Well, not if you're going to have plastic surgery and you get a positive test result on the day of your plastic surgery, because then your plastic surgery will be canceled. And sometimes people's palms are sitting there sweaty as they take that test because they know that they were taking risks, doing things they probably shouldn't have been doing right before surgery when they're supposed to be getting ready and being safe and preparing themselves for plastic surgery. And lastly, doctors do not care about weed, THC, CBD. It's the nicotine, as nicotine causes vasoconstriction, decreases the rate of healing, decreases the rate of collagen deposition, and it puts you at higher risk for post-op heart attacks, blood clots, pneumonia, and even death. Number 9, you're too anxious. Whether you chicken out or your doctor cancels it for this reason, this is a valid reason. And if you are too anxious on the day of your plastic surgery, there's a good chance that your plastic surgery will be canceled. Number 10, you have an unexpected reaction to the anesthesia. So after induction of anesthesia, there could be unexpected changes in the patient, such as arrhythmia, which is an irregular heart rhythm, and that would be a substantial reason for your plastic surgery to have to come to an end and for your plastic surgery to be canceled on the day of surgery. I wish you all the best along your surgical journeys. Thank you for watching. If you like this video, if you learned something, please give it a thumbs up. If there's any way that I could help you get closer to your body, beauty, and or business goals, let's start a discussion down in the comment section below. I can't wait to chat with you, and I will see you guys all again, same place, next Thursday. Peace.